morning.
How are you doing?
I'm doing well. How are you?
I'm doing great. So I'm looking at going to businesses and just kind of doing these interviews, posting them on Facebook, but just giving people like a quick kind of an introduction to the business that's local, and then also looking at how these businesses have changed to incorporate new technology, different things with COVID, and just kind of giving people at least some hope that, there's a lot of cruddy stuff that's going on, but there's also businesses that are still operating and, they're innovating in this time. So.
Absolutely. And I'll do my very best. I'm not sure how good I am at this whole interview kind of thing, but I'll do my very best.
So what I was looking at, let me grab my notes. So talking about, basically what's happened to your business since COVID came about. And then what you've done to change, to pivot, and then probably right now with your business, I've reached out to two businesses, and both of them were like, you really should talk to like a psychiatrist or a therapist. Like they were like, I think people need that probably more than anything. So
yeah, so one of the things that we've been able to do. So Only Counseling Center has been around since 1998, and I actually purchased it in 2006. And since that time, we've grown quite a bit, and we provide mental health services to Olney and the surrounding area. We see about 1,100 people a month. One of the things we were able to do with the COVID was we were fortunate that a couple years ago, we actually went to an online platform. It's called DoxyMe, and it's a secure HIPAA-compliant platform that's completely confidential. So we were giving people the opportunity to receive mental health services in the comfort of their own home. Luckily, we already had that in place. So when we had to pivot, I felt really very strong that I wanted my staff to feel safe and secure and not be exposed. So I asked if they would work from home, and they've been extremely compliant, and it's worked really well. And so we are seeing the majority of our patients with telehealth benefits. And it's worked out really well. We feel like we're providing a really good service to these families.
Right on. So, have you seen? Are the families? Are they seeing benefit in this? Are you getting any pushback? They don't want to do this because they'd much rather just do face to face.
Initially, I think it depends on how you sell it for the most part. But what we're saying is, hey, here's an opportunity. So the majority, probably about 90%, have been willing to do the telehealth. I've been seeing people, seeing teenagers, adults. And one of the things I'm actually noticing with the kids is that I'm actually having a greater connection with them. I'm getting to see their room. They're showing me things that are important to them. Yeah. So in a way, it's a whole new kind of avenue. And they're like, Miss Kim, you're in my bedroom, and so I think they're really, really enjoying it. The people who I think are struggling with it are probably more of the elderly. And so what I've done with them is to have a family member help get them set up. So with our platform, it's actually really, really easy. All you have to do is to call into our office, and you complete forms, just our consent forms. And then what you do before your hour, just a couple minutes before your session, you call into the office at our phone number, and a link is sent to you.
Okay.
So I actually do have a couple of elderly people who come into the office who actually I have my staff set it up for them. And so that's something else we've been able to do.
Oh, very cool. That's great.
Yeah, so it really has worked out. And, I think during this whole COVID thing, it's so important to maintain, the continuity of care with mental health. And, we see so many people that are struggling with anxiety, with depression, frustration. We're seeing all these different changes with the school. So helping people to be mindful, to understand realistic expectations, those kinds of things, I think has been really helpful. And actually, I've really enjoyed being able to transition to this new opportunity.
That's great. So have you seen, for, without being able to clinically diagnose anyone, are there things that you're seeing that really could help the average person kind of on the street just dealing with this?
One of the things, that we're really trying to stress to people is, how can you be healthier and more gentle with yourself and others? Obviously we've never had a pandemic like this before. I think people are feeling out of control and not really sure what to do. And so just really trying to figure out what can you do to help keep yourself healthy, sane, eating right, doing some exercise, sticking to some kind of a routine if you can. What we're finding is that people who are having a routine, their anxiety seems to be a little bit less. I'm also noticing there've got quite a few people who are introverts, and this whole COVID thing is really not bothering them. So that's kind of cool. So they're like, I could do this forever.
Right.
So, but one of the things I am noticing is, particularly with kids, about the social isolating. How do they appropriately social distance but still maintain those connections? So talking about ways and strategies of how they can connect and that their parents feel comfortable with, and all those kinds of things.
What are some of those things you're finding that the kids are, devices kids are using, or programs, or what's working?
They're doing a lot on Zoom. It seems to be pretty big, obviously. They're also doing FaceTime. Lots of people are playing video games online. I actually have several kids who are riding bikes, and so they're social distancing, so no one else is touching bikes, but they're still interacting. I've had people who've had birthday parties. Unfortunately, so many kids are having parties right now, are having their birthdays, and so they're having these Zoom parties. People are dropping stuff off at their house. So,
sure.
I'm really trying to encourage people and the kids to get creative, to start new traditions and try different things. So, because I think this really can be a positive thing. I think there's a silver lining out of this.
Okay. Are you taking on new patients right now?
I am. Our office, we are going strong. We have not hit a bump. We're taking new patients. I have about 10 clinicians who work with me, and you can go to our website, and everyone has different specialties, but we are absolutely seeing new patients. Luckily, the guidelines have changed because we weren't able to see brand new patients virtually, but it's because of the COVID thing. The insurance companies have changed that, or at least for this time being, just so we can make sure that we can get people in and help provide services to them. We're also starting to add some groups and things like that, just support groups, just kind of, like happy hour of, hey, how can you connect? That kind of thing to keep people's spirits up.
How do people find those types of groups? Is that through your practice, or is it public? What do you?
Well, we've started to do. We're just in the beginning stages of doing it at our office. But what I'm finding of people who are doing it online, and I've talked to other professionals, is that people are really wanting to connect. And they are finding it helpful just to have that normalization of, hey, I'm super frustrated. My kid's not doing their homework. I feel like a bad parent. What do I do? So having that normalization and figuring out how not to compare yourself to others, and just remember, we really are in the middle of a crisis, and to do the best we can to be patient and empathetic with each other.
Yeah, that's great.
So,
anything else you can tell us about your business? Questions that maybe I haven't asked?
Let me think. Like I said, we see about 1,100 people a month. So people who most
1,100 people a month.
Mm-hmm.
Between you have 10 clinicians.
I have 10 clinicians. Mm-hmm.
Wow.
And so everyone has different specialties. So you just have to go to our website. It's really easy, and you can find different specialties. I personally specialize in high conflict divorce, those kinds of things. So that's slowed down a little bit for me because of the courts. But we all are doing working with anxiety, depression, ADHD, social isolation. One of the things that what we're doing is, with the COVID, some of the insurance companies don't cover telehealth, and the majority do, but a couple don't. So what we've done is, at Only Counseling, we are giving a 50% off the hourly rate if it's not covered, because we want to make sure that people can continue to get their care. So we committed to doing that until this whole crisis is averted.
Okay. So just going back real quick, in the intake process, so you kind of match up the patient with the clinician based on kind of their needs and personality types? Do they take a test? How does that happen now that we're doing this virtually as opposed to in the office, let's say?
We're doing pretty much the same. So I'm, the clinical director in that, even though I'm the owner. Whenever a referral comes in, I look at it and look at the demographics and what their concerns are.
Okay.
And then I match them. There are people who call and specifically want someone. And so, that works out well too. Our goal is to, and I think we've been very successful, is to, to contact someone within 24 hours. We really want to get people in, because when people are in crisis, that's the time to really get them in and, help provide services.
Wow, that's great.
So we've been really, really fortunate with the DOC-C. I mean, like I said, all people have to do is a couple minutes before their session, they call in to the office. The office sends them a link. They click on it. It's completely HIPAA compliant, confidential.
Yeah.
So we're really fortunate that we're not having to go to Zoom or something that's not, secure. So I think that makes people feel even more comfortable.
Great. So what's your contact information if someone does want to inquire more about your practice and becoming a patient?
Absolutely. So our phone number is 301-570-7500, and that's our direct line. And you can go to our website at onlycounseling.com. And, we have someone that is immediately, responding to emails. So we've got people in the office from 8 to 7 every single day answering phone calls. So you should be able to reach out and get some assistance in some way. And if you can't, we will find someone who can help you.
Okay. And then kind of, future question is, so after this is over, do you have any plans with your business? Have you learned anything that you want to implement, kind of going forward that right now you just can't?
I think what I will want to implement is probably more of the teletherapy, and making it where it's more normalized.
Yeah.
And so I think that we'll actually be able to see more people just because of commuting and things like that. And so I think this is actually giving people the ability to have a taste of something that maybe they were a little bit fearful of before. So I anticipate that we're going to still have an increase of what we did prior to the COVID-19.
Awesome. Very cool.
So.
Well, cool. Well, thank you so much for taking the time. Again, I had this project that I was going to do in my mind months ago where I was going to interview businesses and, kind of face-to-face interviews. And then obviously COVID came in, and now it's kind of freed me to kind of do these, and it's actually easier sometimes to do these too.
Absolutely. And so I so appreciate you doing these, because so many people need to remember that there is help out there, in these essential workers, and that we are taking precautions to make sure that people are safe and, not being exposed. And so no, I really appreciate you taking the time to talk to me, and I'll be interested to see. Please send me the information and let me see what it looks like. And,
yeah.
We'll go from there.
Definitely. All right, Kim. Thank you so much.
Okay. Thank you so much. Okay. Take care. Bye.